Okay, welcome. Thank you for watching. We are live. I am Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. And I've been doing these Facebook Lives talking about different aspects of clinical sleep medicine. So today I'm sharing a little bit about the Clinical Sleep Kit program because registration is going to close today at 8 p.m. Pacific time. It is 5 p.m. Pacific time right now. And so I thought I'll just jump on and just share a bit about the program in case you're interested. And then if you want to join us live, you can join and ask questions. And I'm just putting the link to the program as well in the comments here so that you can take a look. And there we go. Let's see. And I'm just going to update some of the other links. Okay, so you should be able to see the link there. And okay, great. So let me just go back here. Okay, so I think we're all good. All right, wonderful. So the link to the program is in the comments if you want to check it out. It's called the Clinical Sleep Kit. And I'm actually seeing, let me just put it in here again. Okay, so I've just put it in there again. So I'm just going to share a little bit about the program in case you're wondering, who it's for or if it's the right fit for you. This is a program that I created less than a year ago. I created it last year for a few reasons. One is there really isn't anything out there teaching physicians, therapists, and other health practitioners about integrative clinical sleep medicine. I've been doing the lectures for the Integrative Psychiatry Institute on integrative sleep medicine, and just through that experience of doing those for the past few years, teaching those classes, those modules within the IPI fellowship, and interacting with the students in there, I was getting lots of questions about clinical sleep medicine and doing that from an integrated perspective, and it just highlighted to me that we need more education around this. As physicians, most of us only get about 2 hours of sleep education or less during medical school. I got very limited education in sleep medicine during med school. I don't really remember actually learning all that much about sleep, which is kind of absurd because all of our patients sleep, right? Even we sleep. Sleep is really not a priority as well when you're in medical training and residency. And then even in residency, I only got a little bit of training on like sleep apnea, maybe a bit on restless leg. There was like one lecture here and there, but not much. And then I did a sleep medicine fellowship and I learned a lot about how to read sleep studies and how to manage sleep disordered breathing, learned a little bit about CBTI and, basic management of sleep disorders. But again, it was very focused on very specific sleep disorders and not much training on integrative medicine and using supplements, holistic approaches and lifestyle medicine approaches and things like this. And so as I completed my training and went into clinical practice, I started to crave more information. And so I started doing all these classes in integrative medicine and in Ayurveda and integrative psychiatry. And I was really looking for information on sleep and also looking for a community of people who were interested in this approach as well, and I couldn't really find it. So I made it. So it's called the Clinical Sleep Kit program. I started it last year. We've got amazing clinicians already inside the program. If you are joining me live, thanks for joining. And if you have any questions about the program, feel free to put those in the comments, and I'll be happy to answer any questions that you have. So I'm just talking about the Clinical Sleep Kit program because the registration closes today at 8 p.m. It's now 5 p.m. Pacific time, so it closes at 8 p.m. So who this program is for? It is for the outpatient clinician. So if you're a physician, a therapist, if you're a sleep coach, you're a sleep medicine physician, you're an integrative medicine doctor, you're working with patients who ever struggle with sleep, and so that's most of us, right? So even if you're not working in a sleep medicine clinic, you are seeing patients who are struggling with sleep because sleep affects every aspect of health. So it is for you as the outpatient physician or health practitioner who wants to learn more tools to help your patients sleep that go beyond the usual CBTI prescription that can be a little bit restrictive actually for patients sometimes, and that go beyond the usual sleeping pills, which were actually never designed for long-term use. And if you want to get an understanding of integrative, holistic ways to really support your patients with improving their sleep in the long term without having to rely on external sleep aids, you'll also learn how to identify sleep disorders, because the other issue that I see happening a lot is that patients are misdiagnosed. And okay, I'm going to get on my soapbox a little bit here, so be prepared for a little bit of a rant. But this is something I see all the time, and it kind of drives me crazy, which is that when a patient is struggling with sleep onset issues or sleep maintenance issues, they immediately get labeled as having insomnia. And that symptom is taken at face value. And insomnia is a symptom. It's also a diagnosis, but we can't assume that it is the diagnosis until we've done a full evaluation and workup. And for some reason, I see this happening with sleep issues all the time. So for example, like if a patient comes to you with depression, complaining of symptoms of depression, I'm a psychiatrist, so I kind of look at things through that lens. So let's say a patient comes to you with complaints of depression. You don't immediately just jump to treatments. Okay, here's a bunch of meds for depression, or here's some recommendations. You do a full evaluation and workup first because you have a differential diagnosis. You want to make sure it's not bipolar depression. You want to make sure that it's not a medical issue that could be showing up as depression, or that it's medication, a medication side effect. And there's all these differentials that you have in your mind as part of your workup. You do an evaluation, you do a thorough history, and then you will recommend a treatment plan according to what your diagnosis is. But for some reason with sleep issues, I don't see that happening. And I think the reason for this is because as clinicians, we don't really get a lot of training in sleep. And my colleague Michelle Janellis pointed this out when I was talking to her. She's a sleep doctor, a lifestyle sleep doctor. She pointed this out the other day, which I thought was really interesting, is that because we all sleep, everybody sleeps, we're all an expert in a way on our own sleep. And so we feel like we're experts in sleep because we all experience it. So that's why it often gets mismanaged. So that was her theory, and I thought that was really interesting. It makes a lot of sense. So this program will help you evaluate your patients more effectively. For example, I've shared a story of a patient that I saw in a sleep clinic who was only 19. He had been diagnosed by a sleep doctor with insomnia, and he had been prescribed Ambien at the age of like 16 or 17 when he was in high school. And he'd been taking it every night for years. And I was covering that day in sleep clinic, and I saw this kid, and I saw that he was on Ambien every day. And I was like, what the heck is going on here? That's kind of scary. And so I did the full history and evaluation, and it turned out he had delayed sleep phase syndrome, which can look like sleep onset insomnia. And delayed sleep phase is a circadian misalignment, and it's highly manageable without medications. And so we were able to manage it without meds. We got him off the Ambien, and he was so happy and so relieved to not have to rely on a sleeping pill for the rest of his life. He was just a young kid, 19 years old. So you'll learn how to evaluate those kinds of things. You'll learn the signs to look out for, how to have conversations with your patients about these things, how to implement an appropriate treatment plan. And there's really three aspects to the program. So the first aspect is there are pre-recorded trainings. So you can go in there, you can go at your own pace, and you can watch the trainings. There's also guides on how to take a sleep history, differential diagnosis of different sleep issues, how to use different supplements and things like this. So that is just a bank that's there, and it's growing, so it's added to every month. And you can access those at your own pace, and you can also use them when you need to. So for example, one of the mini trainings in there is a sleep restriction and sleep compression training. So if you have a patient where that would be appropriate, you can go into the tutorial and you can learn how to do it, and you can teach your patients how to do it. And so it's empowering for you as the practitioner and also for the patient. So that's the first aspect, is these pre-recorded trainings. Inside of that section, there's also downloadable handouts and different PDFs and resources that you can download and share with your patients in your clinic. The second aspect of the program is a private community that is embedded within the program. And this part is really fun because you get to connect with other practitioners like yourself. I'm in there, of course, and then we've got different experts who are in there, and you can ask questions, you can discuss cases. Right now, today, there's been some really great questions coming up about troubleshooting how to do sleep restriction with different kinds of patients, What about your patient who's tired all the time? Your patient who's waking up at 5 a.m. and they want to sleep later, like how would you manage that? So we've got a rich community and discussion happening in there. So that's the community aspect. And then the third aspect that we have is monthly live Q&As and case discussions. So those are with our guest experts. And this is, for me, I think is like just the gem of this program, because you get access to guest sleep medicine experts from all around the world. And there's such a vast array of knowledge with these experts. They all have their own sort of subspecialties within sleep. So next week, our guest expert is Molly Eastman, and she's an expert on the Aura Ring. So she's going to be teaching us how to use the Aura Ring in clinical practice. Like, is it even clinically useful? We're going to be talking about that. And then on these live calls, people can also come and ask questions. So you can ask questions about patients that you're working with or cases or just general sleep questions. And so this is wonderful. And then we've also got other experts, like pediatric sleep experts, sleep psychologists who can help us with CBTI, cognitive behavioral therapy for insomnia. We've got lifestyle sleep medicine experts, obesity sleep medicine experts, all kinds of people, because sleep is actually quite a vast field and there's a lot to learn. And so it's really fun to be able to have these guests come on every month and we get to pick their brain, really, and learn from them and learn from each other. So those are the three main pillars of the program. And if you have any questions about the program, feel free to put those in the comments and I can answer them. Let's see, what else can I tell you? So how much time does this program take? So it's set up as a monthly membership. It's a not a monthly membership. It's set up as a membership program. So the reason I've set it up this way is because a one-off course or a one-off program doesn't allow for the flexibility of all the different pieces, like the ongoing community, the monthly live calls, the monthly different trainings that are added. So with a one-off course, it's very limited. So that's why I've set it up as this membership that's ongoing. So you get new content every month, and then you can go at your own pace. So how long does it take to go through it? It's up to you. So the monthly live calls are about an hour. So you can block off an hour for those. They happen on Pacific time, usually at 9 a.m. Pacific time, but sometimes some of our experts are in other places like Australia or the UK. So of course, I'm not going to have them come on at 2 a.m. or whatnot, their time. So generally at 9 a.m. Pacific time, but sometimes it might be in the evening. If you're not able to attend those live calls, I know, if you're working with patients, if you're in clinic, your schedule may not allow for that. So you can watch the recording. So all of these live calls are recorded. The transcription is available. So afterwards you can go and read it if you prefer to read versus watching the video. And then the audios are also available. So for all the video content, you get the transcription, the video plus the audio. So you can listen to it podcast style while you're driving, or you can read through it. So you get access to all the recorded content. And then again, you go at your own pace. So if you want to spend, an hour or two, so like the mini trainings are usually about 30 minutes. So it's like a mini lecture. There's anywhere from like 15 to 30 minutes. I like to keep the mini trainings, the ones that come out every month, short and high yield, because I don't like to sit through these long lectures where you get one or two action items out of it, maybe, and then you're like, how do I even apply this to my practice? I like to just get to the point, keep it short, keep it actionable, and just keep it very focused so that you can use it right away in your practice. So those are about 15 to 30 minutes plus the hour-long Q&A. And then in between, there's a question bank that's updated. So every month there's new questions that you can access in the Q bank, and you can use that to prepare for boards and also just test your knowledge and just make sure you're absorbing things correctly. Plus you get CMEs. So every month there's about 3 to 4, sometimes up to 8 CMEs, depending on how much content is there that month. It's going to change from month to month. And so over the course of the year, it's more than 40 CMEs, up to 70 plus CMEs, depending on how the content kind of falls across the year. So that's all included with the program. So you go at your own pace, so you can binge the content if you want to, so you don't have to keep up with anything. And again, I designed it that way specifically because I've done online programs and I really struggle with keeping up with programs and I feel overwhelmed and like, oh my gosh, I'm like missing out. So this is go at your own pace. It's gentle, it's easy, but you will learn a lot. What you will learn in this program, I kind of talked about at the beginning of this video, but it's not a CBTI program specifically. So if you have learned or been trained in CBTI, which is cognitive behavioral therapy for insomnia, you'll get an access to a community of people who can support you with troubleshooting if you're implementing that in your practice. You will learn principles of CBTI that you can use with your patients. And my clinical approach is actually to use elements of CBTI plus integrative medicine plus lifestyle approaches. So I usually don't do like a strict CBTI protocol because I do find that that doesn't always work for people. I kind of have a little bit of an eclectic approach, and so I sort of teach that in the program. So if you're already a sleep physician, we've got sleep physicians in the program, you will learn a lot because you're going to learn all the stuff they didn't teach us in sleep medicine, especially with regard to integrative medicine and holistic and lifestyle approaches. If you don't have any exposure to sleep medicine and this sort of like topic is brand new to you, you will learn a lot and you'll learn how to start having more effective conversations with your patients about sleep. You'll start to learn pattern recognition like, oh, that looks more like a phase issue, a circadian phase issue than insomnia, or oh, those are some subtle signs of sleep apnea that I might have missed otherwise. You'll also get a really good idea of how to conduct an interview with your patients. There's a whole training on, like there's a whole handout thing with like all the questions you can ask your patients when you're evaluating them, and you can also use those in your intake forms and things. So whether you're already a sleep doctor or you're a sleep coach or you're new to sleep medicine, you're going to learn a ton, and we've got just an amazing community of people in the program because everyone has different backgrounds. I'm an integrative psychiatrist and sleep doctor. We've got pediatricians, pulmonologists, like all kinds of people. So it's just so fun to like connect with each other, and you can learn from one another. And let's see. So the price, oh yeah, so I didn't even mention the price of the program. So the price of the program is only $497 for the year, which is like, plus with all the CMEs and all the content that you're getting, I mean, it's a really low cost for this type of content and program. And the reason I made it such a low cost is because it's relatively new. I just started it less than a year ago, and I'm really shaping it with the input of the people in the program. So, so I want to make it accessible. You can join the program at this low cost, and once you join, you get to stay at that price level. I am going to increase the price as the content grows and as the program sort of takes shape even more. So you'll get to benefit from all of that, and you'll get to join at this low price of only $497 for the year. And like so many people have told me, like, that is so cheap for what you're offering. Like you're underpricing your program. And I'm like, yeah, I know. So now's the time, like if you're interested in it, this is a good time to get in because I will be raising the price down the line later this year. So if you join now, then you'll get to just stay at that low rate of only $497 a year. Let's see if there's any questions. If you're joining me live, please feel free to put any questions in the comments. You can also check out the registration page. I've got that in the comments there. It's called the Clinical Sleep Kit. I don't know why there's like a couple links in here. I'm just gonna remove the other one so it's not confusing. There, so you should be able to see the link there. And let's see, what else can I tell you about the program? You can see on the registration page some of the testimonials that people have written, and it's just so lovely to see like how people are benefiting from the program and how it's really changing people's practices. Dr. Renee Drolet, she's a psychiatrist in the Bay Area and the Bay Area as well, so she's a psychiatrist here locally too, and she says that she has so many more tools now beyond trazodone and melatonin. And since enrolling in this program, she has a more systematic and holistic approach to working up and treating sleep concerns. And she says, highly recommend, 5 out of 5 stars. So you can check out the registration page to see what your colleagues are saying. And it's just wonderful to hear that because, you know, when I started this program, it was brand new. I'm a doctor. I'm not a, online course creator. So I'm learning as well. And so it's just wonderful to hear how people are really benefiting from this, and it's motivating to keep going, and also to offer this to more people, because I think, with so many of our patients struggling with sleep, there's very few sleep doctors around the world. In the US, there's only about 7,500 sleep doctors. That's a 43,000 to 1 ratio, 43,000 patients to every one sleep doctor. And I mean, you probably know how hard it is to get a patient into sleep clinic. But there's lots of things that you can do with your patients, short of, doing a sleep study. Of course, those are important to do, but there's lots of other things that you can do, even while you're waiting to get them into sleep clinic. And so this program will give you the tools to be able to support your patients with that. Okay, so if there's no questions, I think we can wind down there. Registration is going to close today at 8 p.m. Pacific time. It's just about 5:22 p.m. Pacific time right now. So if you're interested, now's the time to sign up. Registration is not going to open again until later this year, and it will be reopened at a higher price point. So like I was saying, if you're interested, now's the time to join us. We have a great group of people who have already joined the program, so I'm really excited to get to know everybody. And yeah, you'll be able to join us and connect with the community and learn. So let me know if you have any questions. If you're watching the replay and you have questions, you can put them in the comments below, and I'll just be monitoring those and happy to answer any questions that you have. Otherwise, yeah, I think I've covered most of the main points. But again, if there's anything that comes up, feel free to let me know in the comments. So I will sign off, and I'll say bye for now.